guys, it's Khaki. It has been 41 weeks today since I had gastric bypass the day before Thanksgiving of 2022. It has been a pretty good week. I did, Monday was, of course, Labor Day. So I was off work, and that would have been my mom's birthday. We lost her in 2022, and I sure do miss her. I did struggle some that day with increased hunger, with a little bit of anxiety, and probably that afternoon, I nothing that I ate satisfied me. I didn't eat anything that wasn't on my plan, but I just noticed that it just did not seem to satisfy my hunger. So, of course, I knew it was mom's birthday, and I took a step back and thought, okay, are you really hungry or are you sad? Are you a little bit anxious? And kind of acknowledged those feelings, really allowed myself to miss her, and had a little talk with her, and then the hunger got better. So that really brought home to me how many things that we use food for. We don't just use food to nourish our bodies or fill up our tummies. Sometimes we use food to fill up other emotions, which is, I know for myself, one of the reasons that I got to the point where I needed gastric bypass. So that kind of brought that home to me. Had a good week overall. I did not have much movement on the scale this week. I think I'm down zero point 0.2 pounds, which really did not surprise me. It has not been a great bathroom week, if you know what I mean. That's something that those of us who have had weight loss surgery struggle with. So hopefully next week things will be better in that department, but I feel good. I felt great physically. That does put my weight loss, I believe, to 112.6 pounds, which I'm just thrilled with. I do have something exciting coming up this weekend. Some of the girls from my office and I are going to go to Knoxville to stay at an Airbnb and eat at our favorite restaurant, the Melting Pot. We did have one in Nashville until a couple of years ago, the Christmas Day bombing. I don't know if y'all are familiar with that, but it affected downtown Nashville. A suicide bomber blew up a lot of downtown of the historic buildings on 2nd Avenue, and unfortunately the melting pot was destroyed. So they have not rebuilt it yet. There apparently is some ongoing tension between the historic building committees and zoning and that kind of thing. So we keep hoping it's going to get rebuilt. But until then, we just keep going to Knoxville to get our melting pot fix. I have stayed or have eaten there one time since surgery and did pretty well. It is a fondue restaurant. Normally, there's a salad course, a cheese course, an entree course, and a dessert course. The dessert course has never been my thing, so the cheese course I love, but I find that my thing is if I ate much during the cheese course, I probably wouldn't be able to enjoy my entree. So, what I did last time, what I'm planning on doing this time is just getting a salad, then my entree, which is basically meat and vegetables, and eating until I'm satisfied. So I'm really looking forward to spending time with the girls from the office. Probably will have a couple of cocktails, and I'm sure it will be great. So I'll let you know how that goes. Yesterday, I did have a visit with the first plastic surgeon that I have consults scheduled with. In the spring, I'm planning on having an arm lift brachyplasty and most likely also a tummy tuck. I definitely want the arm lift. The tummy tuck, I'm still contemplating, but it will, if I have both procedures done at the same time, it will be more cost effective. than to have two separate anesthesia events and having to rent the surgical center. And, it is not covered by insurance. So that is something to consider as well. Uh, brachyplasty, my insurance flat out no on the arm lift. Sometimes they will cover a paniculectomy, which is just skin removal, no liposuction on the loose skin on the abdomen. Uh, the surgeon that I met with yesterday, he does accept insurance. The other two do not. But quite honestly, he gave me prices for if I paid cash for everything versus if the insurance covered the paniculectomy part. It knocked a couple $1,000s off if insurance does cover it, which is not insignificant. So he is going to try to see if maybe insurance will cover that. Uh, Dealing with insurance as a provider, I know how funny things are, whether they'll cover anything. So we'll see. I did really like this surgeon. He was very personable, had a great bedside manner. So we'll have to see when I meet with the other two. I'm not going to make up my mind till I assess all my options. His pricing was a little bit less than I anticipated. Uh, you know, Sometimes you have that thought in your mind, do you get what you pay for? So I don't know. He does have mostly very good reviews. There are a couple of negative reviews that I noticed yesterday that kind of are concerning, but here again, as a healthcare provider, I know that you can't ask about that. You can't get any background. They're not allowed to tell you anything about those reviews. So, because of HIPAA. So, you don't know if maybe that was just somebody disgruntled or if it was truly somebody who had a negative experience. So I will wait, like I said, until I speak to the other two options to kind of make up my mind who I'm going to go with. My plans are to have it done in the spring after my at least 15 months after my surgery. And hopefully by then I will have gotten to a stable weight and will be ready for that. So we'll see. We'll see. I hope everybody. Oh, I know one thing. I did have a video request for a meal prep video. So that is something I'm going to work on. I do meal prep most Sundays. So we'll see how that goes. So be on the lookout for that. I don't know if I'll do it this Sunday, but it definitely is in the queue to do at some point. I would love to hear how everybody is doing. Are you having any struggles? Are you having any challenges? Any questions? As I say every week, I'm not a weight loss surgery expert, but I am a weight loss surgery patient, and I'll be glad to answer anything that I can. I would love to hear everybody where you're at in the process, what victories you've had, non scale and on the scale. So I look forward to hearing from everybody. And I will do my best to answer every comment. If you have any request for a video or anything that you would like me to address, please comment below and I will do my best to get to it. I hope everybody has a great week and I will see you again next Wednesday. Bye.